Every person's genetic code, or DNA, is like a spiral staircase with 3 million steps. In people with sickle cell disease, just one step, one gene is defective, which leads to this debilitating, life-threatening inherited disease. People are born with sickle cell disease when the faulty gene is passed from parents to children. It creates abnormal red blood cells that become sickle-shaped, turn hard and sticky, and have a shorter life than normal red blood cells. That means the body's organs and tissues don't get enough oxygen. Organs begin to fail, infection sets in, many hospitalizations are required, and life itself is threatened. People with sickle cell disease suffer with strokes, severe pain, liver, kidney, spleen, and eye damage, bone damage that may require hip and knee replacements, jaundice, anemia, leg ulcers, lung blockage and chest pain, and infections.
I have bad problems with my hands and feet swelling. So they swell really bad and it really hurts.
It was basically because of the sickle cell that made me have to have the chronic transfusions. It's like one after another. Get tired of it, but if it's gonna prolong my life, then I have to do what I have to do.
Sickle cell disease is most common among African American, Mediterranean, Greek, and Italian cultures, but it affects everyone.
Sickle cell disease is a problem for all of us. It is the number 1 or 2 consumer of Medicaid dollars under 18 years and of age in the state of Alabama. It is the leading public health problem by a single gene defect in the nation, and for that matter in the world. They're probably in the realm of about 100,000 cases in the United States. Within the state of Alabama, we estimate that number to be about probably 2,800 to 3,000 persons.
In just the past few decades, research has led to better treatments. In the late 1970s, it was discovered that blood transfusions are the best way to prevent further strokes and other debilitating effects. In the 1980s, we learned that prescribing regular preventive courses of penicillin helped ward off chronic infections. In the 1990s, 2 oral medications were introduced. Hydroxyurea is effective in decreasing pain crises and hospitalizations, and Xjade works to decrease the iron overload that can result from having numerous transfusions.
If we were having this conversation in 1960, I'd say, wow, well, people usually don't make it out of their 20s. Now, average life expectancy would be approaching 50 years of age, so a big improvement in that period of time in life expectancy. Now, where we want to keep on improving is in quality of life, because certainly patients have some problems, especially as they get into adulthood.
Today, a bone marrow transplant is the only known cure for sickle cell disease, but unfortunately, very few patients will ever be a candidate for this procedure.
The risks associated with a bone marrow transplant are significant enough that we have to carefully consider who the best patients are to undergo a transplant. But really, it's possible that we may find another therapy altogether other than a bone marrow transplant that will be able to cure this disease.
Indeed, tomorrow's answer may lie in the research going on right now at the University of Alabama in Birmingham.
Well, our main strategy is to collect a small number of skin cells from sickle cell patients and convert those skin cells into stem cells, and then to correct the sickle mutation, which we can do, and then change those cells into blood stem cells that can be transplanted back into a patient to cure them. And that would be a single treatment that would cure the patient for their lifetime. That's really our goal. We did that in the mouse. We can do that in humans. We've actually already done that in human cells from a sickle cell patient. We haven't published that yet, but we have been able to correct the mutation. I think we've made a lot of progress, but we have to increase the efficiency of that last step in order to produce enough cells to put into a patient. I know we're going to make significant progress in the next year, major progress.
Scientists here are working concurrently on gene therapy and drug therapy nonstop as they stand on the threshold of a cure. But while we wait as these great strides are made, we must go the distance with those who suffer every day with the devastating effects of this chronic illness. Now, more than ever, they need our support and our resources. Your gifts over the last few years made it possible to staff the Adult Sickle Cell Center in Birmingham. Thanks to you, patients who are living longer get the treatment and support they need. Patients, their families, and the medical community rely heavily on the Sickle Cell Foundation of Central Alabama, which provides critical education, testing, and resources, and serves more than 1,000 people in our area every year. Your contributions ensure that this essential work continues.
Sharon Lewis is one of the most outstanding directors of a Sickle Cell Foundation in the country. She has built an incredible relationship between the medical center and the community, and that's essential. And that requires a lot of trust between scientists and physicians and patients in the community. And Sharon is responsible for building that trust.
They helped us get the very first sickle cell grant that we had here in 1988, which was a community block grant that helped us begin to develop our patient population.
Education is key because, the smarter we all are about things, the better we are at being able to take the treatment, give the treatment, and live the life.
Education, research, compassion, and caring. These provide hope for people living with sickle cell disease. We've come a long way in science and understanding, and maybe one day soon, with everyone's support, we can celebrate the end of suffering caused by this debilitating illness and celebrate life.